Now, the other hemodynamic disorder that we want to talk about, which is not relevant to coagulation, is edema. And this is due to abnormal accumulation of fluid within the cell, interstitial, or tissue and body cavities. It can be caused by different reasons, and one of them is increased vascular hydrostatic pressure. Example of it is heart failure, cirrhosis, or venous obstruction. Now let's think. When there is heart failure, blood is not moving as it should move, and that causes stagnation of blood. So there is increased vascular hydrostatic pressure, and water tends to move out from the vasculature into the interstitium. Here you can see we have edema of the lungs, and here you can see the edema in the lower extremities. And the other reason of edema can be decreased plasma oncotic pressure. This is seen in patients who are suffering from, for example, liver disease. Because we have low albumin, low albumin rises the oncotic pressure and absorbs water out of the interstitium. So when there is low albumin level, then we have presence of edema. Also, lymphatic obstruction and inflammation can cause edema in patients. The last hemodynamic disorder that we want to talk about today is shock. Now, shock is generalized hypoperfusion of the body, means that that the blood is not sufficiently getting into different parts of the body. It is characterized by systemic hypotension due to either reduced cardiac output or reduced effective circulation volume. So what we have to mind is that this is systemic hypotension. So many organs are undergoing this situation. There are different reasons that lead to shock. One of them is anaphylactic shock, anaphylactic reaction, you can see here. Or, for example, cardiogenic shock, which is due to dysfunction of heart. We can have hypovolumic shock, and we can have septic shock, which is due to infections. Alright, now comparison between different types of shock. So the first type is hypovolumic shock that we want to discuss here. And when it happens, that when we have pooling of blood from the systemic to the periphery, and the systemic blood supply is lower. Some of the symptoms that we can face when we have hypovolumic shock is hypotension, tachycardia, or weak thready pulse. Also, they look pale and cool. The skin is moist. In cardiogenic shock is when the heart cannot pump the blood properly, so blood is not getting into the organs. There we are developing cardiogenic shock. For example, in cardiac tamponade, we can have cardiogenic shock. Here again, we have decreased cardiac output and we have increased SVR. We can have neurogenic shock, and that's when these neural pathway are defective. They cannot maintain the venous arterial tone, and that causes venous and arterial vasodilation that causes pooling of blood to the periphery, and that eventually causes neurogenic shock. Now, anaphylactic shock can happen secondary to due to hypersensitivity type 1, when we are introducing a sort of allergen to a patient when they are allergic, and that causes pooling of blood in the periphery, so systemic blood is reducing, and that causes shock again in the patient. Septic shock can happen in patients who have undergone severe infections. And septic shock can causes non-specific T cells activation, and it can causes peripheral vasodilation, which leads to lower decreased cardiac output and decreased SVR that eventually causes shock in patients. So when we are talking about shock, there are 3 stages. First stage is the initial stage, and that's when body switches from aerobic to anaerobic metabolism. The second stage is when our body starts to and is trying to compensate the problem that has occurred in our hemodynamics. So what happens is sympathetic nervous system stimulate catecholamine release and cardiac contractility in order to maintain the hemodynamics. Now, in order to maintain the hemostasis. In here, our body tries to compensate this matter via shunting the blood to the vital organs to maintain the blood supply in my vital organs. But unfortunately, this stage cannot last if the shock is severe, and then we start to get the progressive stage of the shock, and that's when the body can no longer maintain the balance, and that leads to electric imbalances that can lead to metabolic acidosis, which can raises the pH of our body. And rising pH blunts the vasomotor response, and that causes peripheral edema and hypotension. The last stage of shock is irreversible or refractory stage. This is irreversible cellular or organ damage, which means even if we be able to raise the volume of blood in patients, because there has been cellular damage or organ damage, that's irreversible, and we cannot do anything for those organs. So this is the end of this chapter.